Shockwave therapy is a non-invasive method that uses pressure waves focused to a point within the target tissue to treat various musculoskeletal conditions. High-energy acoustic waves or shock waves deliver a mechanical force to the body's tissue to heal many chronic painful orthopedic conditions. Here are some literature that presents evidences on the effectiveness of ESWT. In summary, it has been promoted as an alternative to surgical intervention in treating rotator cuff tendinopathy. At present, there is some high-level, low-quality evidence on the efficacy or effectiveness of high-energy ESWT in reducing pain and increasing function among patients diagnosed with calcific rotator cuff tendinopathy. And also, there is no evidence of efficacy and effectiveness of ESWT in treating non-calcified rotator cuff tendinopathy.
The contents of the PICO table will be discussed later with the flowchart presented. So let's first start off with the study design, which is a controlled trial study according to the type of data, objective, and methodology used. For the flowchart, on the left side of the flowchart is the experimental group. As you can see, 29 patients were treated with ESWT with 0.28 millijoules per millimeter square on a total of 31 shoulders. After 1 week follow-up, 3 discontinued and another 3 after the third month follow-up, with 17 patients or 21 shoulders remaining at the end of the study. On the right side is the control group with 20 patients or 26 shoulders being treated on with ESWT with more than 0.07 millijoules per millimeter square. After 1 week follow-up, 2 discontinued and another 2 after a 3-month follow-up, leaving 16 patients or 20 shoulders after a 7-month follow-up. For you to be qualified, you will need to have calcific tendinitis and chronic shoulder pain for at least 6 months, with unsuccessful treatment or interventions of the following therapies: local infiltration with anesthetics or glucocorticoids, physiotherapy, electrotherapy, including ultrasound therapy, or oral analgesics. People with malignancy, systemic infection of bones or joints, pregnant women, people with cardiac pacemakers were not included in the study. There were no sample size calculation done, and the purposive sampling was used with the set criteria specified for the participants. Metric properties for all are not identified in the study. Radiographs were used to measure calcifications, 100-point constant score for shoulder function, and the visual analog scale to measure shoulder pain.
After 7 months of extracorporeal shockwave treatment among 43 patients, 57 shoulders, 19% from the treatment group and 8% of control group, obtained a complete rotator cuff calcifications reduction, while 19% from the treatment group and 8% from a control group had greater than 50% reduction in calcifications. In total, 38% of the patients obtained a result of complete shoulder calcification reduction or improved by greater than 50%.
This graph shows the improvement in constant score, wherein hatch bars represent the data of the treatment group while open bars represent the data of the control group. At 1 week after the ESWT, constant scores improved significantly in the treatment group, while the control group did not reach the level of statistical significance. A maximum improvement was noted in the 7th month after the ESWT in both the control and treatment group, but the treatment group showed more improvement than the controlled group. The strength is the use of purposive sampling, which contributes to the uniformity of the baseline data of the participants, while the weaknesses are as follows. First is the absence of computation for the sample size. Identifying the sample size could have helped in reducing the chances of committing an error. Next is the difference in age, because the value in standard deviation has a significant difference. And in addition, reactions to treatment will vary more due to the changes in the body as a person ages. Lastly, the presence of bilateral shoulder pain may be perceived as a higher grade in the visual analog scale, which could lead to different findings. For the methods, Bias in the study was eliminated through double blinding and the random assignment of the subjects. Using the intention to treat method also ensures that changes in the number of participants will not exclude results from the experiments. While intake of painkillers is considered a weakness because it could affect the perception of pain in the visual analog scale. So for the statistics, the utilization of the intention to treat method was used so that changes in the number of participants would not affect or change the power of the study. The normality of the data was ensured by the use of the Kolmogorov-Smirnov test. The ANOVA assessed the shoulder function and pain both at baseline and after treatment. Weaknesses of the statistics of the study include lower improvement of the condition and that the extracorporeal shockwave therapy was not clearly compared to other treatments for the same condition. Weaknesses of the statistics of the study include lower improvement of the condition and that the extracorporeal shockwave therapy was not clearly compared to other treatments for the same condition.
Based on the evidence provided by the study, despite the results reported that there is a significant difference between the two groups, justifying that the intervention is effective in resolving the shoulder calcification by greater than 50% in 38% of the participants, other studies suggest that shock waves produced affect the healthy bone tissues, permitting partial osteocyte death. Other studies show that the use of shock waves produced high stresses in the boundary surfaces that generate tensile strength that produces cavitation. Cavitation might produce free radicals that could result to cell damage. Weighing the pros and cons, further studies are needed before the use of ESWT can be seen in different clinics. Also, a unified parameter. Protocol is needed to prevent the adverse effects. Therefore, the use of ESWT for shoulder calcific tendinitis is not yet encouraged.